r/AskReddit. Psychologists of Reddit, what's one thing a patient has told you that caught you off guard, or vice versa? Patient's perspective? My therapist once abruptly ended our session after telling me I needed to go to the ER. I had been in a car accident the day before and had an undiagnosed concussion that was pretty bad. I was so out of it, I didn't even realize I was out of it. He later told me I was talking about inappropriate topics. I was so embarrassed I didn't ask what I specifically talked about. I didn't want to know at that point and wasn't making much sense. I'm just glad he recognized I was off that day and helped me get to the hospital. During my first and only session with a particularly memorable child psychologist, he referred to me as a miserable bitch. It was true, but he didn't have to call me out like that. I was in a psych hospital as a teenager. While all the patients went to their rooms to do homework or whatever, the mental health techs/nurses would do their shift change. They'd have a meeting to update the night shift on how the patients were doing and anything that happened earlier in the day. My room was right next to the kitchen, which was where the meetings happened. One day, my door was slightly open and I decided to listen in on the meeting. The first thing I hear is the main tech saying, "Mravector Rabt. Sigh, he's a mess." I never held it against him because I knew it was true and he was a really good guy, but it was a little shocking hearing it said so bluntly. It's definitely funny in hindsight. I'm a clinical psychologist working on the back end of my post-document. I work predominantly with acute adolescent presentations such as chronic self-injury or sexual trauma. I'm so used to the young people I help hating themselves. It hurts a lot inside, but I firmly believe in catharsis through positive regard and validation. So as we do our therapy, I often sprinkle in comments here and there about some of the things about them that I admire, respect, or appreciate. Things like their perseverance, their kindness, or their passion for an interest of theirs. I'm always so caught off guard when they agree with me or say something nice about themselves that it's really the only time I find myself slightly tearful in session. I'm always so damn proud of them and it hurts to hear the depths of their self-hatred. Those little moments of growth make me feel like it's the first warm day after winter. As a child sexual trauma victim who's been through a good deal of therapy during my teens, I'd like to offer a little insight from my perspective. I'll probably make a general statement or two, just know I'm speaking from experience and it's probably a slip up. After all that I went through, the self-hatred, guilt, all the miserable feelings were there. The normal stuff. The odd thing was, I knew and acknowledged I was a good person. I knew I was smart. I was a solid test taker. I had a lot going for me. I was strong and perseverant. I knew all these and nobody had to tell me. It was nice being told it, but I knew. I think, and I could be wrong, but I think that as victims we are often aware of what we have that's good. It's the fact that trauma is such a primal sensation, or condition, or whatever word I'm missing here. I can acknowledge all I want, that I'm a good person trying to do my best, but even after all the therapy I went through, I still can't help feeling guilty and miserable at times. I can't generalize and say I know every trauma victim, or even very many, but I feel like this is common. Your brain knows you're a good person, but somehow it can't accept it. It sounds so contradictory, but it's the best way I can describe it. Telling those kids and getting them to admit that they're okay is a huge first step because it never really stops. You just drown the self-hatred with self-love. You tell yourself, sometimes forcefully, that you're a good person and that you deserve good things or that life's worth living. I think that's the biggest thing though. It's teaching kids like me to love what they already know about themselves, not to replace the hatred. But in spite of that, I know this is long and very much anecdotal, but it's something I seem to see in the handful of other trauma victims I have met. Although I'm not the most perceptive person, nor am I a therapist. Maybe I'm wrong, but if this could help even one person, or many, I figured it is worth sharing. Edit. I'd be here all night responding to everyone who has and will comment on this, but I wanted to say thanks to everyone for sharing your experiences. I'm glad to see this resonated with people. I almost deleted it and didn't post it, but I'm glad I did. Edit #2. I decided to go through and comment on what people have posted so far. I feel like I owe it. I've had a super rough weekend, and every person who's messaged me or left a comment so far has helped me so much. I was starting to feel like I didn't have much left to give. This made me realize I absolutely do. To anyone who may comment down the line and I may miss, thank you. The same for everyone who already has. Also know that just because your trauma isn't sexual doesn't make it any less traumatic, and these feelings may still be there and are just as valid. Context. I work a lot from an existential perspective. At this time I was working at a jail and talking to a guy who hitches rides on trains. We were talking about what he would have to do to change his life, to not just get high and ride trains. He looked me square in the eyes and told me he's freer than anyone else he comes across. He isn't indebted to a 40+ hour work week, bills, or debts. He just hangs out with friends and travels state to state. He articulated how he knows he'll die young from missing a jump, but that ultimately he'll have lived and died as he wanted to. It was a conversation that really forced me to be cognizant of human freedom and choice. He wasn't disordered, he had chosen his own path and conclusion. The only thing he was doing wrong was breaking the status quo, the law. Frankly, who am I to judge or decide how to live a life? From then on, I was more careful to never tell a patient how to live or what to do. I'm only here to help someone think through their life and pick their desired direction. I have come to use a lot of sophist techniques to get patients to their own eureka moments. Edit, had a brain fart. I meant Socratic, not sophist. I was in my second ever session, which coincidentally was right after my nan's funeral. I was talking about some stuff that had happened with my sister, who I had already said was probably my biggest issue, and he asked, why is this person in your life? Why do you want to continue a relationship that hurts you so much? Do you actually want this relationship? I was floored. It had never occurred to me that my sister didn't get a place in my life by default because family. I can't tell you how much this improved my life. I'm really messed up, been hospitalized a lot. I go through moments of such intense delusions that I'm no longer myself. I was admitted once after trying to get my veins out of my arm, thinking they were wires. The doctor that was assigned to me wasn't really expecting me to be so paranoid. While in the observation room, he was trying to talk to me, and I blurted, what's it like being a robot, Mr. Robot Man? I said man kind of like marijuana, and he started laughing. He wasn't expecting it. I wasn't either. I laughed with him. He was such a nice East Indian man, and hearing anyone with the same accent makes me feel lighter somehow. I had one tell me I needed to learn to bite the bullet, which turned out to be good advice, even if it was blunt. Edit, I wasn't there because I was suicidal or anything. I was there because my mom and I had a pretty volatile relationship. She had some emotional issues where she'd just lash out at me over things that didn't make sense. And if I needed to learn to stick it out until she got better, which she eventually did, and we have a much better relationship, really paid off. I had a therapist tell me when I was a teenager that she didn't know what else to do to help me because it seemed like I already understood everything pretty well. This was after my overbearing and crazy helicopter mom dragged me in for being depressed. Then she switched to therapying my mom, and my mom quickly was in tears because she has the emotional strength of a child and wanted it to be about me when it was actually all about her. I knew exactly why I was depressed. I was stuck by myself in the middle of nowhere with her crazy ass. No personal space, no ability to get away, not being able to say no, her getting jealous of my friends when I spent time with them. It would make anyone depressed. She didn't even let me sit with the therapist by myself. I did most of my training in a pediatric hospital. One of my patients, young adult, with relapsing leukemia, cancer since young childhood, wanted to go to an outdoor festival with their significant other. The oncologists were adamant that due to the patient's slow white blood count and current course of treatment, they shouldn't let them go. Basically, if that person caught an infection, it would kill them. The patient was pissed, understandably so, and said something like, "I've had this disease since I was a child. I know I'm going to die soon. I'm going to the concert, whether you like it or not, and if I die, then at least I'll do it on my own terms." It's always quite moving when a young person expresses their own mortality and confronts it head on. I had such admiration for that person. Patient here. In response to me telling my therapist that I was prescribed Wellbutrin for my depression/anxiety, my therapist stated that it was a medication that a lot of adults with AD see a positive effect with. It threw me off for a second, and I was like, that's cool. Why do you say that? Therapist: because you have AD? Me: what? I do. Therapist: yes. You present very typical AD for adults. Me: therapist: I thought you knew already. Me: nope. But that explains so much. I also got a second opinion just in case, and it turns out I absolutely am AD. Thanks doc. Lol. I have been seeing my psychiatrist since I was 15. I just turned 22 and less than a year ago he put me on Ritalin for ADHD. I was like, I have that? And he said, yes, remember I had you take that assessment a few years back. Then he pulled out the assessment and sure enough I have ADHD. I asked why I just found out about this. He said I already knew, but he didn't see any reason for medication because I wasn't struggling in school too much. Last year I started online courses for the first time since graduating, and I could not for the life of me do the work. So he decided to put me on the meds and now everything is so much easier for me. I only found out I was formally diagnosed with autism at an early age when I 18. I don't remember getting assessed, and at the time self-diagnosis of Asperger's was in vogue. And I didn't want to be one of those people. But I'd been seeing psychiatrists twice a year, local law regarding psychiatric drugs prescribed to minors, since grade 2 for ADHD and other assorted comorbidities. It would have been nice getting proper treatment for my meltdowns at an early age. I have no idea why my psychiatrist at the time didn't explain it to my parents, though to be honest it's possible my mother didn't understand what the diagnosis meant and just forgot to follow up. I just assumed I was a bad kid who threw tantrums often.